Hi, my name is Richard No. I'm going to do a head-to-toe assessment today. This is my patient here. Of course, before we start anything, we have to do a complete history on the patient, including current and past, and also any medication that's related to the patient's symptom. Furthermore, we need to, before the patient enters the room, we have to observe the patient mobilities to see if are they able to walk by themselves, are they able to need assistance, are they on support, are they need a cane. So that gives us information about the patient condition at that point in time. Now, before we go into the head-to-toe assessment, prior to that we have to do weight and height. We also do other vital signs to make sure everything within a normal limit. Okay, now we go ahead and start the head-to-toe assessment. Of course, before we do that, we have to introduce ourselves to the patient. Hi, I'm Richard. I'm with your nurse today. Can you tell me what's your name?
Hip.
Hip. What's your birthday?
January 1st.
Okay, why are you here today?
To have an assessment.
Okay, you know what day is today?
Sure, today's June 22nd.
Okay, what time is it?
About 3 o'clock.
Now, by introducing myself to the patient, I'm able to detect a couple of things. First of all, the handshakes tell me I can detect which the temperature, the skin, and by making eye contact to the patient, I'm able to tell us that how is the patient's facial expression, and that is tell me is very crucial information about the patient, the condition at that point in time. Now, the next step what we do, we will generalize inspection. The facial and the head area to see is there any abnormal side, so we look at the head to see is there any abnormal hair loss, any a scar tissue that might indicate the patient might have some kind of trauma before. So by looking at that, and also look at the face to see is the face everything is symmetry. Okay, after the inspection we go ahead and proceed with the blind palpation. Okay, we check for see any tenderness, if any pain then?
No.
No, okay. Now when we do that, we also check the look pressure here for the frontal sinus here, and also the maxillary sinus here. Any pain here?
No.
Okay, good. Now the next step is we go inspection the eye, look at the eyes. Can you open the eye big for me? Okay. We look for any dryness, any redness, any drainage. Okay. Now we also look at the eyelids. You see any jaundice, any yellow underneath? Okay, good. Now next one, I will check your pupil dilation. Okay, go ahead and open the eye big for me. Okay, that's good. This one, open. Okay, and of course you want to make sure this the pupil constriction when you sign the line there, and make sure it's symmetry on both sides. Now the next step, I will check the integrity, the muscle integrity of the eyes by having the patient follow my finger. Go ahead and follow me. Good. This way. Good. Up. Down. Okay. This way. Go up. Down. This way. And this way. Okay. And by doing this, we're checking for the cranial 3, 4, and 6. Now, since we at the head and the face area, I want to check to see the integrity of the cranial nerve 7 by have the patient making a face expression. Can you smile for me? Can you make a face? Flick your eyes. Make an ugly face. Okay, good. So it seems that the patient able to do all that motion. It seems like the cranial nerve 7 is still intact, which is good. Now the next one we will examine the mouth, and before we do that we have to ask the patient are they wearing any dentures or anything in there that might cause a complication. So of course we have to talk to the patient before we have to do the mouth examination. Now can you open the mouth for me? Okay. While looking for the integrity of the teeth, look at color, serration, look to see the uvula. Say "ah" for me. Okay, now we want to see the uvula, see that midline, and we also see the tongue, see that midline at all. So far everything's good, everything's there. We also look for any lump bump, any scar tissue in there. Okay, so also if everything look good. Now the next step what we do, we're going to palpate the carotid artery. And when you do this palpation, it's very important that you do one side at a time. Because you don't want to do two sides at the same time, you might decrease the blood circulation to the patient. So we'll check for the carotid artery. Okay, that's look good on this side. Okay, that's look good. I'll go ahead and auscultate the carotid artery, listen for Rui. Okay. Okay, now the next step is we will palpate the lymph nodes, the cervical lymph nodes. And the purpose of this is we want to see is there any tenderness, any swelling there, or any kind of abnormal and maybe enlargement of the lymph nodes. Because the enlargement, then maybe the patient might have infection, they might have other symptoms that we might need to look further into. So the first one I look at, one right here is underneath the mantle, okay, and we do both sides on under submandible, okay, and we do palpate on the post-occipital, okay, and we do a supraclaviculus, okay, and we also do a posterior, and also we do a supraclavicular lymph node palpation. Now the next step we will do the upper extremity examination. Before we do that, we want to check the skin temperatures. Okay, see how they're feeling. See if they have good circulation. Okay. Now we also check the turgor. Okay, see if the patient is hydrated or dehydrated. Okay, we do on both sides. Okay. Next step is after we inspecting the skin of the upper extremities, the temperatures, and the turgors. Now we'll go ahead and palpate the radial pulse. And we do this for about 50 seconds. We want to see how the pulse feels like, weak, strong, as the rhythm. Okay, that sounds good. Now we will decide. Okay, and after that we'll do a cranial pulse. And the same thing, we will check for the characteristic of the pulse is weak, strong, the radii. Okay. So the next step I will do is I go ahead check the reflex. Okay, the radial, the bicep, and the tricep reflex. Okay. Would you mind relaxing for me? Okay, good. Relaxing. Okay. Now we'll do a tricep reflex. Relaxing. Okay. Do this side. Relaxing hand for me. Okay.